Hello, friends. Welcome to the topic of claim rejection. So, as a being into doctor profession, it's very difficult, to tell patient after the claim is rejected and make him to pay. He will never pay. He will say it's your fault. You have not done. So, it's the thing is, we should know what is the basics. What is the basics for when insurance company can reject a claim? First is in individual policy. Already I have told you if it is 3 days clause, 30 days clause, 1 year clause, 2 year clause, 4 year clause. If anything before that waiting period comes to you, suppose on 29th day malaria admission occurs, even if platelet is 20,000, it will not be given because there is a waiting period was there which was not crossed. So claim got rejected. Second thing is how companies reject the claim is first they make every claim, it should be genuine, it should be reasonable, and it should be justifiable for hospitalization. So suppose a person with malaria with platelet count say only 1.25 lakh and comfortably taking food has got malaria positive report and goes to the hospital. So usually claim will be denied. You'll be surprised. Why claim got denied? 30 days also cross, 2 months cross, then this fellow got admitted. But the thing is, claim is genuine. We don't say that the patient report is not malaria. The claim is genuine. Total bill of 3 days was sent around 25,000. That was reasonable. But the third thing was hospitalization was not justifiable as there was no vomiting sign. Patient was very comfortable. So why not to try medicine? OPD basis. Why not a family physician can treat? Why the patient directly got admitted to the hospital? Or even in the hospital, why consultant directly admitted? There is no problem with the patient paying and getting off the hospital. But the thing is, this is very important. So what is there is, if all the waiting clause are not covered, claim will be rejected. Second, even if waiting clause are covered, still claim is not justifiable. It was genuine. It was reasonable but not justifiable, it will be rejected. Third thing is cosmetic. So commonly patient approaches eye surgeon for LASIK surgery. LASIK surgery is comes under cosmetic, so it is not covered at all. Cosmetic is not covered. Then there are few young girls who wants dimple like Priti Chinta. So this by Botox they want to give and try with this. But anything cosmetic is never covered. Until unless it is an accident, you will not get covered. Then the thing is, as I said, many of the patient will tell you, doctor, I have a backache. Why don't you get me hospitalized for 24 hours? My insurance advisor told me 24-hour hospitalization, I'll cover everything. My motto is to get MRI done of 9,000, 10,000 value so that I'll sleep in the hospital for 24 hours. Wrong. Claim will get rejected. Now, clear-cut thing is, when you need hospitalization, you have to give diagnosis. So, what is the diagnosis? What is the diagnosis? Hospital says, I don't have the diagnosis. I want to investigate. Investigation is never covered in hospitalization. So, be careful. Your patient claim will be rejected. So that's really very important thing. Then the thing is, sometimes you'll say, sir, this patient having policy since 10 years, so a very long policy period. Now he wants to get his eye cataract done. So what happens is, sometimes we see even the patients, even simple claim which was a very easy, got rejected. Patient writes, I have a diabetes and BP since 12 years to 15 years. He has taken Mediclaim 10 years back. That time he has not written, not declared, I have a diabetes and BP. That means he has done forgery. Insurance is based on some material fact. If you declare you are healthy, we can take. So if you have hidden some material facts, if you would have got diabetes BP, insurance company would not have given Mediclaim to you. So if you say so many times I come across eye surgeon writes there is no direct relation between cataract and diabetes BP. See, the question is not of diabetes and cataract. The question is a fraudulent thing, hiding of material facts, which was very important. So that is thing. Second, pre-existent. This example which I shared, it comes in the pre-existent one. Then admission for checkups for anything. There are people who will come to you, sir, I will sleep for 24 hours, get my full body checkup done. Sorry, tell them sorry, it will not be done. Then surcharges are not covered. Then consumables are not covered. Then consumable, what, I'll tell you in a simple language. See, even if you do 5 lakh TKR, 7 lakh TKR, you will get 7 lakh TKR. But the thing is, you will not get a walker of 3,500. This is simple. You're taking home that. So it's consumable. It's for you only dedicated, that you will not get. Then nowadays many more things is like, the patient, your patient has not gone to cashless hospital. He has gone to some other hospital which was not on cashless. He has not intimated. That means within 24 hours he must intimate. Suppose he say he was alone, he was unconscious. Okay. But at the time of discharge, when physician or a surgeon writes, he is absolutely okay, he is fit to discharge. Okay, but till that time also you can intimate your claim. So intimation, not intimation of claim, it's very, very difficult to get your claims right. And second thing is, you have intimated the claims, but you kept the file with you for 3 months, not submitted. How will you get the claims? Then one more thing I wanted to add in this is a proportionate deductions. What is proportionate deductions? Is like, your client, there are some patients, relatives who come to ICU admission, then the reception, the Mediclaim is of 1 lakh value. Okay, and your bed charge is of say 7,000 rupees. In that case, patient died after 3 days and bill is 1 lakh. Finish. Relatives will not pay anything. They will say you did not say anything. From that 1 lakh policy or even 2 lakh policy, patient will not get more than 50-60,000, because 1 lakh 1,000 room, 2 lakh 2,000 room, 3 lakh 3,000 room. So 1 lakh mein he is eligible for 1,000 rupees room, and ICU it's maximum 1.5 times or double. 2,000 is justified for his Mediclaim. So hospital bill was 7,000 per day bed charges. So it's like 3 times multiple. So if bill is say a policy is 1 lakh, bill is 1 lakh, you'll get around 35,000. So 65,000 he has to pay from his pocket. So these are the some very basic things which I've shared. It's like no positive reports came in your IPD papers, nothing positive in your IPD record. Supporting evidence mein all your reports, sonography, blood report, everything normal. Then this was room rent proportion factor. Then his policy may be having capping, like he has come for TKR, total knee replacement. He is having a policy where there is a capping of 2.5 lakh. Even if he has done 7 lakh expenditure, insurance company will not give more than 2.5 lakh. So that is called capping. So even if it is a policies of 10 lakh, as a doctor, we feel 10 lakh means 10 lakhs. No, never. Read the very fine print. It is clearly written. It's clearly written. We have a capping of 2.5 lakh for anything, whether it is a cancer, whether it is a paralysis, whether it is a cardiac element, whether this is TKR or a spine surgery or any major surgery, we'll give 2.5 lakh only. And second, another very important is co-payment. Patient will say, bill is 1 lakh, bill say 5 lakh policy, bill is also 5 lakh, room was proper, but there was a co-payment and a 30% co-payment rule was there. So he has to pay 1.5 lakh, but he'll say, why I should pay? My is 5 lakh, your bill may be exorbitant, you must have increased the bill. So it's never like that. So because you don't know, you're not gone through his terms and conditions which are written in a fine print. So that is very important. Don't ever commit anything It's, see, we are doing best for you, best treatment. We'll send this request as per room. What you tell us, we'll send the approval, and what approval comes accordingly. So it is a basically, it is very important for sound relation. Take security deposit. So in case if you don't get, then also you are safe. Thank you. This was about a 10-minute video of the claim rejections, common things. Thank you, friends.